Hi everyone, Dr. Sylvestre here. The tibial compression test, or the tibial thrust, is a test that's very practical to help diagnose a partial or full cranial cruciate ligament tear. I personally like the tibial compression test because in the large dog, I find that it's an easier diagnostic tool for cruciate tears than the drawer test because I have smaller hands, and in a big dog, it's more difficult to get my hands around the dog's thigh, stifle, in order to create the drawer test. The other thing I really like about the TCT is I can do this test with the dog standing. So when I have a patient and I suspect it might have a cruciate tear, it'll still be standing. I'll give it a big rub down, kind of go rub its back leg and just gently position the leg, pick the foot off the ground, and do a tibial compression test. So my patient stays relaxed. You know, the minute you lay a dog down on the floor, they know you're going to do something and they get all tense, and it can make it more difficult to successfully do a drawer test or even a tibial compression test. The other thing about the tibial compression test that I really like is that I find it's a little more sensitive for those partial cruciate tears than the drawer test itself. At least in my hands, maybe it's just how I do the different tests, but I prefer the tibial compression test for the minutia of motion that you might get with a partial cruciate tear. The hard part about the tibial compression test is getting the hang of how to do it. It's a little bit less intuitive, I'm going to say, than the drawer test. And it does take some practice. You really just have to develop a feel for how you're making the body parts move and how you're holding your hands to successfully do a tibial compression test and believe that you are doing it correctly. Let me tell you, the key to doing a tibial compression test is to never change the flexion or position of the stifle itself. So you're only creating motion in the hock, and it is really important not to allow any change in the amount of flexion that you position the stifle in. Watch the video as I demonstrate how to do the tibial compression test, and keep that point in mind about never changing the flexion in the stifle as you do it.
The tibial compression test is best done with the dog in lateral recumbency. The stifle is slightly flexed, it grasps the paw, and then flex the hock. What this will do in the cruciate deficient stifle is cause the tibial crest to be popped or pushed forward. Again, note the tibial crest getting pushed forward beyond the patella. This should not occur if the ligament is intact. Again, the position is a slightly flexed stifle, grab the foot, just flex the hock.
I hope you've enjoyed this video. Thank you for watching. Please hit the like button and subscribe to my channel.